this is a question I always had from my experience with my dad. And you have all these symptoms of cachexia, but somebody who's getting a very rigorous treatment of chemotherapy and radiation and like invasive surgeries, how do you tell the difference between the effects of the cachexia and the effects of the chemotherapy? Because you can just treat the chemotherapy and think that's the effects of that and think that's all you got to do, and you might have this thing lurking underneath that you're not paying any attention to.
The answer is you can't separate them. It's impossible to separate there's classic side effects that you might be able to, like a combination chemotherapy, which I'm sure your father received, but kind of distilling out all of those pieces, it's like taking a multiple choice test and the answer is D, all the above, all the above. And to what degree and how is still out there. We just still don't understand it all.
I mean, I agree. Where I would disagree, I do agree with most of what you said. Where I disagree is, sometimes there's such toxicity from treatment on top of the cachexia, where nausea is so significant, and that's continues to contribute to weight loss, where we take a pause in the treatment and really try to get a sense of, if we hold this treatment and really be aggressive in some of the supportive care measures, whether it's outpatient fluids or IV antiemetics or even hospitalization, to see if we can make up some of the ground that we might have lost, possibly making an adjustment in the dose of the treatment, or even changing treatments if we're feeling it's having such untoward effects. So cachexia is such a multifactorial thing, so that's where it is going to be hard to uncover, and the treatment can cause direct effects on the muscle, so it really is very difficult to unwind.
Yeah, I think that's been our experience, that this seeing people at multiple time points, you can start to correlate certain things. You get a sense of, most of that nausea is chemo related, or it's related to the huge lymph node mass that they've got in the upper abdomen or something, because it's changed. When that shrunk, everything got better. But I'm arguing against labeling people too firmly with a one-stop shop. I think there's a huge place for iterative management and iterative adjustment of the best plan, but also the best sort of impression and overall assessment about what's going on with the patient.